EMS workers in the Khayelitsha District Hospital are calling for proper protective personal equipment. Now, how we're representing workers there say they're disputing the amended personal protective equipment requirements for health workers on the front line. The Health Department in the Western Cape says it had no choice but to send the striking workers home for refusing to use equipment provided for staff members. Newzroom Afrika's Ghana was there.
I'm joined by two staff members who've been working at the Khayelitsha District Hospital for several years. I'm going to start off with Charlotte Clark, who's going to talk to us about the plight of the workers. Charlotte, if you can just briefly summarize why you have found yourselves in the situation or in the predicament where you have downed tools.
Yes, our plight once again is we want to go back to work. We want to go back to the road. We want to go back to serve the community. But we firstly need to protect ourselves. Secondly, we need to protect the community out there. And thirdly, we need to protect our families we have to go back home to tonight. So we're pleading with our employer, please give us all the necessary possible PPE that you can give us so that we can go out and serve our community like we're here for. Thank you.
Charlotte, the department says to us in response to our inquiries that they have given the staff members protective equipment according to some guidelines. What do you say to that? Is that not enough for you?
My dear, that is not sufficient enough. To use a visor, a mask, an apron and gloves only for confirmed or suspected COVID-19 patients is not enough. We're asking for the A40 suit, which is the white suit, the full suit, and that will make us feel we're really protected.
Talking about the A40 suit, I'm now going to bring in Themba Mgidi, who's going to talk to us, as well as a staff member, about some of the amendments in this paper that you have in your hand. I believe that this is the guidelines, some of the guidelines to what the EMS workers should have when they go out to deal with possible cases of COVID-19. What are you disputing, Themba? Thank you so much for your time.
Okay, you're welcome, ma'am. Okay, firstly, so we've got a circular that was signed by Dr. Klute, that is the head of our Department of Health Western Cape. So the circular states on paragraph 3, the last line, that the employer will provide any necessary equipment, the PPE that we want. So now we went to look at the WHO and the provincial guidelines. So they state that all the emergency care workers, they will receive an N95, so each day. So now the manufacturer's instruction is also saying you're wearing it once. However, by the employer, they're saying we can wear it 5 times. So after the N95, also on number 3, the World Health Organization, they said you must wear N95 in conjunction with the A40 pack suit. However, this document that was signed by Dr. Klute, it's been edited. And it's not been written who edited it, who goes the authority of above World Health Organization. As much as we understand it's a pandemic, it's a disaster, occupational health and safety, everyone is in a constraint in this moment. But we're still against the document that was signed on our behalf without consultation of us. Thank you.
All right, thank you so much. Themba Mgidi, one of the workers here, and Charlotte Clark, who are talking to us about the plight here at the Khayelitsha District Hospital. We know that in Khayelitsha alone, there's already over 300 positive COVID-19 cases, and the Western Cape coming in as the epicenter of the virus. Now, we know that several experts, including Professor Karim, have mentioned how problematic the community infections will be if they are not properly managed, and workers here are speaking about the lack of the right protective equipment that they want. We know that Nahau is currently now in talks with some of the health officials here at the district Khayelitsha Hospital to try and ensure that everything that was mentioned here by Charlotte Clark as well as Themba Mgidi is followed through by the department, even though the department has responded to say that they've given the workers all the protective equipment that they can give them according to their guidelines, and that they've asked them to return home if they cannot serve and work here at the Khayelitsha District Hospital. Now for Newzroom Afrika on channel 405, I'm at Team Tongana in Cape Town.